begin.
Hello, thank you for your interest in the Aylmer-Elgin-St. Thomas Community Safety and Wellbeing Plan. For those of you who don't know me, I'm Julie Gagnon, and I'm the Chief Administrative Officer for the County of Elgin. I'm also the staff lead for this very exciting project. As you know, we're really hoping to see all of you in April. And we want to thank you for your understanding, as we're off to a bit of a slower start than we originally expected when we began planning for this exciting initiative. We have pivoted our plans to ensure that we're still engaging the community, and we're moving to mainly online and virtual ways for you to become involved. Before we get started, I'd like to pass it over to Elgin County's Warden, Dave Mennel, City of St. Thomas Mayor Joe Preston, and the Mayor of the Town of Aylmer, Mary French, for brief opening remarks.
Good afternoon. Dave Mennel here. I'm the Warden of Elgin County, and the County of Elgin and the City of St. Thomas and the Town of Aylmer are working together to develop a joint community safety and well-being plan that will strengthen how we collaborate with our partners on important issues that impact safety and well-being in our region. The Safer Ontario Act 2018 mandates that each municipality in the province prepare and adopt a community safety and well-being plan. These plans will mark a shift in focus from a reactive, responsive-based approach to incidents to a more proactive, holistic approach to community safety. This shift in focus will result in reduced pressure on first responders, as the community safety and well-being plan will focus on social development, prevention, risk intervention, and incident response. Our goal is to achieve a sustainable community where everyone is safe, has a sense of belonging, access to services, and where individuals and families are able to meet their needs for education, healthcare, food, housing, income, and social cultural expression. Back to you, Julie.
Thanks, Warden Mennel. Over to you, Mayor Preston, please.
Well, thank you. Everyone has a role to play in safety and well-being, and we're seeking your feedback as we develop our community safety and well-being plan. The advisory committee will bring together various sectors and perspectives to provide strategic advice and direction to the coordinating committee on the development and implementation of the plan. We need to hear from you about the best ways for residents, organizations, and government to work together to address well-being and safety issues in our communities. We thank you for taking the time to participate in the planning process. We recognize that safety and well-being cannot be addressed by one organization or sector alone. Too often, incidents arise from mental health addictions, homelessness, and housing concerns, and they require an emergency response from the police and other first responders. Many of these incidents could be addressed earlier through the greater collaboration among sectors, including the police, education, health and social services, and other community-based organizations.
Thank you, Mayor Preston. And we'll ask that Mary French, Mayor of the Town of Aylmer, share some opening remarks.
Thank you. My name is Mary French, and I'm the Mayor of Aylmer. We look forward to working with you throughout the planning process as we work to engage citizens, businesses, agencies, and organizations in making Elgin, Aylmer, and St. Thomas healthier for all. Increase our understanding of local risk factors, reduce demand for emergency response and acute care, ensure individuals are receiving the right response at the right time by the right service provider. Increase the reputation of Elgin, Aylmer, and St. Thomas as a safe and healthy community in which to live, work, and play, and increase the community's sense of pride. This plan will define community safety and well-being planning in Elgin and St. Thomas over the coming years. But it is not a final destination. Community safety and well-being issues will continue to evolve and we are committed to ongoing engagement and dialogue to ensure that the plan remains informed, relevant, and reflective of evolving needs. Regular updates on the planning process will be posted on the Community Safety and Wellbeing Planning website. The final plan will be made publicly available, and if you have any questions about the planning process, do not hesitate to contact the coordinating committee. Contact information and a link to the planning website will be shared at the end of the webinar.
Thank you, Mary French. In order to assist with the development of our community safety and well-being plan, we've hired an external facilitator, Jennifer Kirkham of Mischievous Cat Productions. And I'm going to pass it over to Jennifer to have her lead you through a brief overview of our approach to developing our community's plan.
Great. Thanks, Julie. And thanks to all of you for your opening remarks. So today is really an opportunity to give you a brief overview of the Community Safety and Wellbeing Plan project and Elgin's approach to moving forward with the plan. So what we'll do is we're going to go through a number of different things. We're going to give you a bit of an introduction to the project. We'll talk about governance and the advisory committee role, which is you, the approach we'll be taking, some of those project milestones, how we can stay connected, and then talking about next steps and how you can continue to be involved and engaged in the process. So why a community safety and wellbeing plan? You heard from the wardens and mayors that the Ontario government is requiring all municipalities across Ontario to develop a community safety and wellbeing plan and to adopt it through each of their councils. This plan, though, is broader than what we think of traditionally as safety, which a lot of people think of as being crime in a community, and it's moving the focus to also look at the social determinants of health. The municipalities in Elgin are working collaboratively to develop a joint community safety and wellbeing plan for all of the municipalities in Elgin. So this includes the City of St. Thomas, the County of Elgin, the Town of Aylmer, the Municipality of Bayham, Municipality of Central Elgin, Municipality of Dutton-Dunwich, the Township of Southold, the Township of Malahide, and the Municipality of West Elgin. So a nice unique approach where we're seeing some collaboration happen across the municipalities to develop a joint community safety and wellbeing plan. Just to provide you with a bit of history, this isn't something new. The province of Ontario has been thinking about community safety and well-being, and they identified it as a priority policy area for them in 2012. So you'll see over the course of sort of 2012 to where we are today, a number of different documents that have been produced as part of the work that the provincial government has been doing around community safety and well-being. So you're seeing 3 documents, one being Crime Prevention in Ontario that was released in 2012. In 2014, the province released a document called Community Safety and Well-Being, a Snapshot of Local Voices. And then the most recent document was released in 2017, and it provides a planning framework for community safety and well-being. So as a community, we'll be looking to that planning framework to help inform the work that we do as we develop our local plan. All of these documents are available on the Government of Ontario website if you are interested in taking a closer look at them. So within that planning document that I talked about that was released in 2017, the province has provided some requirements in terms of the planning process that they'd like to see happen at the local level. One of the key pieces they provided, you'll see in front of you, which is a community safety and wellbeing planning framework. This framework focuses on the 3 areas you'll see on the side of your screen, which is collaboration, so having people and services and agencies work together on information sharing and on performance measurement. You'll also see that this planning framework identifies 4 areas in which communities can be made safer and healthier. So you'll see in the middle that red one, which is incident response, moving out to risk intervention, then prevention and social development. So as we think about developing a community safety and well-being plan in Elgin, we'll want to think across both all of those 4 areas in terms of thinking about safety and well-being. So I'm going to give you just a brief introduction to each of those 4 areas so you have a better sense about what they are. So if you think about that middle of the circle, which is the incident response, this is the area that represents what is typically thought of when people think about crime and safety. So these are things that require immediate, a reactionary response, and usually have a sense of urgency. So think about your community, you think about police, you think about fire, emergency medical services, child welfare that involves removing a child from a home, a school principal expelling a child, so those immediate and sort of reactionary type of responses. But as the province realized when they were developing a framework, initiatives in this area alone cannot be relied upon to increase community safety and well-being. So they've thought about adding some other sort of circles to their planning framework. So the next circle out that we need to take a look at is called risk intervention. So this is the second area of focus. This area of focus is really about involving multiple sectors working together to address situations where there's an elevated risk of harm. So really thinking about how do we stop something bad from happening right before it is about to happen. So risk intervention is intended to be immediate, to prevent an incident from happening while reducing the need for incident response, which was that first circle. So for example, you'd see here, how do we prevent sort of risk or victimization or harm from occurring? The third area of focus is called prevention. So prevention involves proactively implementing either a measure, a policy, a program, or initiative to reduce priority risks before they result in crime, victimization, or harm. So this would involve looking at things like what are the crime or disorder trends in our community, who are the vulnerable people and places in our communities, and the identification of priority risks in order to plan and respond most effectively. The final area of focus in the community safety and well-being planning framework is social development. So social development is longer term when you think about how do you make a difference in this area. It tends to require multidisciplinary efforts and investments to improve social determinants of health. And in this area, we look at things like education, early childhood development, food security, poverty, quality housing. So some of those social development pieces that actually improve people's community safety and well-being. So those are the 4 focus areas that you see in the community safety and well-being planning framework provided by the province. The other piece the province has provided in their planning framework is a number of critical success factors. So what they're saying is these factors need to be in place to ensure that your community safety and well-being plan will be successful. So not a surprise, I'm going to just quickly rotate through the wheel for you. Strength-based, so really leveraging what's already being done in your community, collaborating to do more, leveraging your local expertise. We move around to risk-focused, is focusing on the risks, so really preventing something bad from happening before it happens. Making sure in terms of awareness and understanding that everyone understands what their role is in making the community a safe and healthy place to live. Highest level of commitment, so making sure you've got dedication and input from a wide range of sectors, agencies, organizations, and groups. Due to the complex nature of community and safety well-being, effective partnerships is a critical piece. So it means no single individual, agency, or organization can fully own the planning process. It needs to be a collaborative or multi-sector process. Evidence and evaluation, so that what goes into the process, it should be based on evidence. So where you'll see, as I talk a little bit later, how we're gathering a lot of data about our community to make sure that the information that goes into the plan is evidence informed. And then finally, culturally responsive. So making sure that we're open and respectful of different cultural differences across our communities. So these factors all need to remain a focus as we move through our planning process for the community safety and well-being plan, and as we sort of put a lens on our final community safety and well-being plan. There are a number of mandatory requirements for the community safety and well-being plan. So these are requirements that the province has put in place So initially, they wanted municipalities to prepare and adopt a community safety and wellbeing plan by January 1st, 2021. Based on our current context and situation, extensions will be granted for that if required in terms of the timeline. The province has also required local communities to establish a multi-sectoral advisory committee. That's you. That's why we're sort of reaching out to you as a starting point. You'll see a list of sort of different sectors that need to be a part of that. And consultations must be held with the community. In terms of planning, the province has also asked that there be sort of 3 steps in the planning process. They want local communities to identify their priority risks. Based on those priority risks, they want strategies to be identified that will reduce those priority risks. And then in terms of making sure we're making a difference, they want to see some measurable outcomes put in place as well, so that we can actually measure whether or not the strategies we've put in place are making a difference in those priority risk areas. So this gives you sort of a good overview of the project as a whole, so community safety well-being. Now what I'm going to do is switch gears and talk about what the community safety and well-being planning approach will look like in Elgin. So in terms of project governance, we've got 2 key groups that will help lead this project. One is the coordinating committee. So the coordinating committee is going to lead the development of this collaborative community safety and well-being plan. You'll see on the screen there the different members or representatives that are on the coordinating committee. The other group that will help with this is the advisory committee. So the advisory committee will provide advice to the coordinating committee. Instead of limiting the advisory committee, so on the previous slide, I showed you how the province sort of mandated who should sit on the advisory committee. The approach that the municipalities have decided to move forward with is that the advisory committee will be an inclusive process. So all welcome, anyone who wants to sit on the advisory committee is welcome to sit on it. So we're not sort of selecting who would sit on it. And that's you, you're our advisory committee. So as a member of the advisory committee, we're gonna look to you to act as a resource for the coordinating committee to help provide us with data and information or access to data and information about the communities to help us identify the priority risk factors, to work in collaboration with the coordinating committee around identifying what should go in the plan in terms of priority risks, the strategies that will address those risks, and as well to set up the measurable outcomes for it. So this slide shows you that we're moving forward with 4 phases in our approach to developing the community safety well-being plan. Phase 1, up in that top corner, is really the starting point. So looking at project planning and onboarding. So we're doing some kickoff meetings and finalizing the project plan. This is part of that. This is our kickoff meeting with you as the advisory committee. We'd hope to do it in person, but for now, online and virtual will work for us. So this this video that we're doing for you today will sort of complete phase 1 of the project. We're also in phase 2, which is the research and asset mapping. We're currently collecting data about the community and research that's already being done to help us begin to identify some of the priority risks in the community. And we're also mapping current community assets. So one of the key pieces we're doing right now is doing an inventory of planning tables and some of the work that they're doing and their strategies and focus of those planning tables. Phase 3 will be a focus on community engagement. So we're going to be using a number of different methods to engage the community and other key stakeholders, including yourselves as the advisory committee. We're going to be starting this phase shortly with an online survey for you to complete for us. With our current situation, you'll note that we'll be moving, most of these activities will be online or will be conducted virtually. Phase 4 is really where the plan starts to take shape. So this is where we use the information that was collected in phase 2 and 3, and we begin to build the plan out. So identifying what are the priority risks we want to focus on, looking at asset maps in terms of what's already being done in each of those priority risk areas, identifying strategies to move forward with, building out that evaluation framework in terms of measurable outcomes and other performance measurement metrics. As a member of the advisory committee, your help will be critical in this phase of the planning. So phase 2 that we're focusing on right now is collecting a lot of data and research about the community. In the Community Safety and Wellbeing Planning document that the province put out in 2017, they identify a number of risk factors in communities that may impact community safety and well-being. So we've developed a data template and are gathering data across each of those 4 areas of focus that I talked about earlier. So we've got a data template, and these are, you'll see on the screen that we're collecting data in each of these areas, and we'll be asking for your help in this area in the online survey that you will receive shortly. So the timelines for the project have altered slightly. As Julie mentioned earlier, we're off to a bit of a slower start than we'd hoped, but what you'll see in front of you is that we're going to probably remain a little fluid in terms of what the timelines look like. But what I wanted to show you is that there will be an opportunity after each of the milestones, so after each of the phases, for you as an advisory committee member to actually review what was collected and documented during each of the phases and work through it with us prior to the coordinating committee looking at any of the completed work. So how do we stay connected? The County of Elgin has developed a web page that you can access to obtain up-to-date information about the project. So you'll see the address there on the screen. So I welcome you to take a tour of the page, forward it to others you think may be interested in being involved in the project. There's lots of great information up on that website. So let's talk about next steps. These are some of the things that you can expect as we move into the future with the planning process. So as I've mentioned a couple of times, watch for an online survey to be sent to you. So we'll be asking for your input about data that your agency collects. We'll be asking for input around any local research you think could help inform the development of the Community and Safety Wellbeing Plan, and ask you for some of your preliminary thoughts around what you think some of the local challenges, issues, and risks are that we should be focusing on in the Community Safety and Wellbeing Plan. If you lead a planning body, number 2 on the next step is we're doing an inventory of planning bodies, looking at a template where you can provide us information about your focus and the strategies that you're working on as a planning body. We're going to complete our data collection and identifying sort of the highlights of what we're seeing or the key findings from the data about our community. And then after working with our coordinating committee and looking at the information that's being collected, we'll be holding an online working session with you as the advisory committee to review the data, the results from the survey, and begin to identify potential priority risk areas that should be included in the Community Safety and Wellbeing Plan. So you'll also notice on the side of the screen that we've provided an email address if you'd like to stay in touch that way, or if you have questions about the Community Safety and Wellbeing Plan, as well as the website to access the page that provides more information about the Community Safety and Wellbeing Plan. So myself and the coordinating committee, we're really looking forward to working with you as part of the project, and stay tuned for further opportunities to become involved.